Sure. Yeah, I'd be happy to do that. Well, thank you all so much for having me here today. I feel really honored and grateful to join you all and to talk a little bit about my work. So I'm going to share my screen for my slides. And I will definitely echo what you just said that my research specifically looks at public libraries, but I definitely think that this applies in academic libraries and archives, especially community archives as well. So yeah, so without further ado, I will get started. So can everybody see the screen okay? See my slides? Okay, don't see. Okay, I see head shaking, so that's good. All right, good sign. All right, so today I'm going to talk to you about supporting patrons in crisis, leveraging social work approaches to empower public librarians. Yes, you will receive a copy of the recording. Whoops. Oh no, here we go. I'm going all the way through the presentation. Let me start over. Okay. All right. Got it. Okay. So some things that we're going to talk about today and that I'd kind of like you to consider, not just through my presentation, but hopefully through some conversation that we have after the presentation, are the following questions. So first of all, we'll talk about what it means to experience homelessness or to be unhoused. We'll also talk about what library patrons are going through right now. So beyond experiencing homelessness, what other kinds of issues do library patrons face in our communities? We'll talk about what's happening in libraries right now, how libraries and library staff in public libraries are responding to the needs of people in crisis. And then we'll talk about how social work skills can help inform librarianship and library practice. So first off, I want to start out with a scenario to kind of frame our discussion. And this scenario comes out of some of my prior research and is very similar to issues that have arisen for many staff that I've talked to about their experiences working in public libraries. So imagine that you're working at a reference desk at your local public library. A homeless teenager approaches you near the library's closing time of 8 p.m. The teen is visibly shaken and anxious because she has called all of the shelters on the street information card that you gave her earlier in the day, and none of them can take her in for the evening. She asks for your help to find a place to stay, and you do not successfully find a shelter. The library is closing and the teen is panicking. So my question to you is, what do you do? So you can share your thoughts about what you might do or what concerns you would have in the chat. If you just kind of want to talk about it while I'm presenting, totally fine. But just keep that in the back of your mind. And like I said, this is something that a specific scenario from a library staff member that I spoke to while doing research. So this is a real scenario that can and does happen while working in a public library. So I also want to touch base on what it means to be homeless or unhoused. And the reason for this is because when we think about homelessness or being unhoused, people often associate that experience with particular assumptions. The first of those is the appearance of someone. So oftentimes we imagine someone experiencing homelessness to be unkempt, to have a lot of bags, perhaps to have a body odor or poor hygiene. There are also assumptions about mental health and substance use that those two things are very highly correlated with being homeless, but the reality is that it's not much higher than the general population. And if you think about what someone's going through, it would make sense that these issues may be a little bit higher for someone who is unhoused. There's also an assumption that people who are homeless are in that situation because of poor life decisions or because they won't find a job. There's an assumption that people experiencing homelessness are dangerous or that they're criminals and that they're not really part of the community, that they're transient and they've just come to the community for the resources that they can take advantage of. However, I want to point to the realities of being homeless or unhoused. The first of which is that being homeless is rooted in many factors. It's not something that people choose. If we kind of think about it, why would somebody choose to be homeless or unhoused? And, it's an individual situation. So it could be rooted in a lot of individual factors. It can also be a result of trauma. It can be community driven. Maybe there's something happening in the community that impacts someone's lived experience. People experiencing homelessness, they don't look a certain way, right? This has come up in my own research where staff have assumed that someone was homeless and they weren't, or assumed that they weren't homeless and they were. So you really can't base assumptions on homelessness based on someone's appearance. Additionally, homelessness can be temporary. So just for a brief time, maybe someone's moving and they don't have a place to stay for a couple weeks. I know I've been in that position as a student moving across the country. It can also be episodic. So maybe someone is homeless over the summer, but then they stay in shelters over the winter, or they have a place to stay over the winter. It can also be chronic or continual. People who are homeless or unhoused are often very well educated. They're often employed, working very hard, and just unable to keep up with the cost of living, which I know, especially in New England, is always a concern, right? Which really ties into my next point about affordable housing and policies, which can limit the available housing and make it really tough for somebody to be able to find stable or permanent housing. Again, I think New England's a great example of that, where even if you have a voucher for housing, maybe landlords don't take it, or maybe there's just nowhere to rent, right? So the other point I want to make here is that people experiencing homelessness are much more likely to be victims of violent crime than perpetrators of it. So oftentimes people become homeless because they're escaping a dangerous life situation, and that's really the only option for them at the time. So ultimately, I just want to emphasize that people experiencing homelessness are part of our community, and they're part of our library communities as well. So I started thinking about people experiencing homelessness in the library when I was working in a library myself. And I worked in a small rural library where if we had someone come into the library who was homeless, we did have some policies and programs in place to support that individual. But ultimately, kind of the go-to plan was for a police officer to come in and give that person a bus ticket to the next largest city that supposedly had better resources for that person. So kind of just shuffling them along rather than really being able to help them. But that was my experience. But conversations around homelessness and public libraries, they go back pretty far in the history of public librarianship, but I want to touch on one particular time period that's really relevant to our conversation today, which was the late 80s and early 90s, and particularly this case from Richard Kramer, who is a man who was homeless at that time, and he is still homeless as of 2019, but he filed a lawsuit against his public library, the Library of Morristown, New Jersey. And essentially, what was happening was the library was having issues with Mr. Kramer. And so they started writing policies and enacting them essentially in order to be able to expel him from the library. So the policies were related to body odor and hygiene, use of the library, how people were dressed, how they interacted with other patrons. And then those policies were used to enforce behavior in particular ways, one of which involved kicking Richard Kramer out of the library. So throughout this court case, originally, the decision was made in favor of Mr. Kramer. And eventually it was overturned in favor of the library, but with some caveats about respecting First Amendment rights, ensuring that policies are broad enough to be applied to everyone and not specific to certain individuals who come into the library. But I really appreciated some of the points in the original ruling, one of which is that library policy can't condition access on distinctions between patrons. So access has to be for everyone, not just for specific patrons. And the other one was that libraries don't ban books and they can't ban patrons no matter what. And so really what's important about this case is that it facilitated a lot of discussion that has since continued around the role of public libraries and public librarianship in spaces for people experiencing homelessness and in providing services to people experiencing homelessness as well. So I think we can see that in some of the policy developments that have happened over the past couple of decades. But I just want to point this out because it was sort of an important point in fostering conversation around how public libraries support patrons experiencing homelessness. So the case with Mr. Kramer, some of my personal experiences and some additional research that I did really inspired some of my earlier work around looking at how public library staff deal with issues related to their professional roles, their responsibilities, and the boundaries that they sort of enact and maintain and sometimes break or recreate when they're providing health and social services information to people experiencing homelessness. And so for this project, I looked specifically at 3 different library systems and interviewed 24 library staff there. So that did include librarians, library managers, and paraprofessionals, all public library systems. And just a few highlights from that work. One of them was that, unsurprisingly, library staff want to help, but they don't always know how to, at least in the case of supporting people experiencing homelessness. Additionally, empathy was really central to the work that staff were doing, but empathy also impacted the ways in which boundaries were maintained. So sometimes empathy would cause someone to break a boundary. Other times it would cause someone to, maybe go above and beyond or give someone a ride, even though they knew they shouldn't, or something like that. Additionally, the library as a place to be is crucial. So just having the space of the library for people experiencing homelessness was really, really important. And then finally, folks talked a lot about the opportunities for social work and librarianship, and particularly social workers in libraries. But a couple, actually several people mentioned this idea that librarians connect people with information, but social workers connect people with resources and support. So kind of making this comparison between the specific tasks that librarians and social workers have to play or have to manage. But what came out of my work was that, well, actually library workers are also providing resources and support as well as information. So there is this overlap or lack of distinction between the roles, which means there's an opportunity there for the 2 fields to kind of inform each other. So those are a few highlights from that project. But what we're interested in today, and that is what is still relevant for today, is what library patrons are going through right now. And so we talked a little bit about what it means to experience homelessness or to be unhoused, but I also want to point out a couple of trends that I think are pretty relevant here. Before COVID, between 2019 and 2020, the number of people experiencing homelessness had increased by a little over 2%. But what's important here is that that was an increase for the 4th year in a row, and that was before COVID. So the impact of COVID obviously still being measured in terms of people experiencing homelessness, but there's also been an increase in evictions. And what's emerged is this need for continued funding to support shelters so that they can create, continue to offer shelters that are safe spaces from a public health standpoint for people experiencing homelessness in order to avoid overcrowding, which is a typical issue with homeless shelters. Also, as public libraries, have either been open for much of the pandemic or reopened, there are challenges that require additional time and resources and funding there, right? So everything from managing mask requirements to managing item pickups and things like that, additional technology, lending options, virtual programming, all those things require additional funding and support. Beyond that, folks are facing other crises such as mental health crises from this collective trauma with COVID, right? Maybe folks are fleeing domestic violence situations, dealing with substance use. Racism and policing in communities is another issue that's really come to the fore. even more over the past year or so. And then loss and grief, particularly due to COVID, but due to other things, can really um, put a toll on folks, right? But the important thing I want to note here is that, like, yes, these things are definitely impacting library patrons, and library staff are managing those concerns with patrons as they're helping them. But these are also things that library staff are going through right now. I've gone through loss myself, and loss and grief, and it's very difficult. So everyone's kind of going through their own trauma and their own situations. That said, I think kind of the wonderful thing about libraries, right, is that they're continuing to provide support for both their community as it faces crises, and patrons as they're experiencing crises as well. So these are just a couple of examples that I wanted to share with you. There are plenty more out there. But on the left-hand side is someone named Adina Jones, who is an AmeriCorps volunteer with Dallas Public Library. This is from a couple of years ago, so may not be current, but she's assisting a homeless patron during an annual winter backpack challenge, which was part of the library's homeless engagement and leadership program. This middle image is from the Providence Community Library in Rhode Island, which has several branches that operate as walk-up COVID-19 vaccination sites. And I know some libraries also operated as testing sites as well. And then on the right-hand side, there's a librarian who's holding a first aid kit with Narcan, which is used to treat opioid overdoses. So many of these programs and more are made possible because libraries are partnering with other community organizations. But so it's just a few examples of the ways in which libraries are supporting both their communities and individual patrons. So just to share a few more examples, in addition to Narcan training and having Narcan on site for overdoses, a lot of libraries have been at least talking about harm reduction or choosing harm reduction practices. So in bathrooms, having sharps needle disposals for people who are intravenous drug users, instead of using blue lights, which can hide the ability for someone to find veins if they are a drug user. And if you had a blue light, like, yes, it might deter someone from using drugs in the library bathroom, but it might also put them in a vulnerable position where maybe they go somewhere else that's not as safe of a space for them to be. So choosing harm reduction in that way. Additionally, peer outreach programs. So this is the image depicts Renee Hines, who is a peer specialist for DC Public Library. So waiting to greet clients, someone who's been in recovery themselves and is there as a peer specialist to provide support. Additionally, library workers have had kind of an increased focus on health and well-being in libraries, both for patrons and for staff. So everything from like yoga and mindfulness courses to self-care, thinking about, heart health, you name it, it's happening. Also, communication and de-escalation training skills for staff is another important one, as well as a host of policy changes. There are a few examples here, including extended hours, particularly if it's very hot or very cold. So again, people who are vulnerable have a place to be. Going fine-free, which is an equity of access issue, right? Bag or sleeping policies. So instead of policing the library to ensure that people aren't sleeping, finding out why they're sleeping, checking in to see how they're doing, and providing support. And then, as I mentioned, community partnerships. So working with businesses, social services organizations, local government agencies, and things like that. So library staff and libraries are doing a lot to support patrons and communities in crisis. So takeaway there. So a lot of the things that I just mentioned really coalesce with social work skills and social work practice in a lot of ways. So, from my past research, it was clear that there was an opportunity for libraries and their staff in terms of partnering with social workers or learning from social work. It was something that they were talking about and very interested in. And part of that was role clarity, and part of it was just getting support to meet these continual and emerging needs of patrons. So thankfully, I was able to find a social work research collaborator, Dr. Lydia Ogden. She's in the School of Social Work here at Simmons. So it's been really interesting to kind of put a research lens on some of these practice-related issues that public libraries have been dealing with. But just to kind of reiterate why I think social work is such a valuable field, first of all, and second of all, to connect with librarianship. I just wanted to show you this image here, which is, two hands grasping together. You see words like assist and bridge. And this image is actually from the University of Buffalo's social work education program website. And, it shows a host of skills and qualities that social workers may have and activities that they would engage in. But I think what's really interesting is actually, it's on their website, but they have a list of 10 characteristics and skills of successful social workers. So I want you to listen to this list of skills and tell me, well, you don't have to tell me, but think about which one of them, if any of them, are not librarianship skills. So we have empathy, communication, organization, critical thinking, active listening, self-care, patience, professional commitment, and advocacy. So pretty much all those skills, except maybe self-care, at least until recently, and maybe patience, although we definitely need patience as librarians. We don't explicitly mention that as a skill. All those sound a lot like librarianship, right? So I just thought that was an interesting way of thinking about how sort of this like skill convergence and the opportunities for collaboration here, because librarians and social workers actually have a lot in common. So aside from sort of the role overlap there, Dr. Ogden and I have been considering this question about social work service models and their utility in public libraries. So some additional prior work from Province et al. Illustrates, along with our work, that public libraries are frequented by patrons, not patients, who are experiencing unmet psychosocial needs. And actually, using libraries to support meeting those needs is a success story in some ways, right? It's wonderful that libraries can provide that support. However, sometimes those needs exceed what library staff are capable of, and what is the scope of their jobs, right? So in particular, that can be very difficult if you're supporting unhoused patrons or those who are experiencing other crises and who have additional greater basic needs. So social work service models are helpful here, right? Because they're informing the ways in which we can support patrons who have these particular needs. And the image here, if you're not familiar with it, is of the Boise Public Library, which I had to put in here because they have an exclamation mark on their library name. And that's a whole other amazing marketing story, but Boise Public Library, check it out. So this brings me to some current work that I've been focusing on with Dr. Ogden, which sort of helped establish a rationale for us in terms of the social work service models within libraries. And that was a series of focus groups and subsequent workshops that we conducted with the Boston Public Library System. And so essentially this study told us that, again, library workers want to help. I found that in my previous study. They want to feel empathy, same thing. They also want to be fair, have this egalitarian mindset. They want to serve everyone equally well, which is really important. However, in order to do that, library staff had to overcome a series of barriers, including training, figuring out how to say and do the right thing, safety concerns. So being the only person in the library presents its own host of difficulties, issues of vulnerability. So fear of confrontation, fear of being manipulated. Like say you do help someone out and then, they keep coming back to you, or you find out, oh, well, the situation isn't what I thought it was. This person's using me or whatever. Own lack of confidence can be difficult. Staff also talked about facing racism from library patrons. And then this issue of role diffusion where, you're monitoring everything that's happening in the library. You're dealing with lots of children, dealing with overdoses, all these important tasks that support your community, but also bleed into things that you need to get done within the scope of your day, which can be really tough to manage. So we've also looked into some existing library social work collaborations. So one of those is where libraries have a social worker on staff. So might be somebody full-time, might be somebody part-time, which requires funding, right? Might also be social work interns, which is something that I'm still really interested in. It does require supervision, resources, time, ultimately money, right? There's also a model that invokes wandering resource coordinator or social worker outreach team as somebody goes from branch to branch, which can be helpful for providing support to branches, but it's kind of spotty and inconsistent, which presents some difficulties, particularly for the patrons who are making use of those services. Then you also have a model where social workers train library staff. And then you have a model where you're specifically bringing in trauma-informed care principles into the library. So I'll talk a little bit more about that model because that's one that we're kind of exploring right now, but it's called TILT, the Trauma-Informed Library Transformation Model. So the TILT model is designed to create a trauma-informed library atmosphere. So first of all, what does it mean to be trauma-informed? Well, according to SAMHSA, which is the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, long acronym, individual trauma results from an event, a series of events, or a set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning mental, physical, social, emotional, or spiritual well-being. So in a trauma-informed setting, staff understand and take into account the impact of trauma, toxic stress, and adverse childhood experiences, recognize the signs and symptoms of trauma, respond by fully integrating this knowledge into policies, procedures, and practices, and resist causing further problems. So that's a huge mouthful, but essentially what it means is that that we acknowledge the impact of trauma in the lives of our patrons and in our own lives. So this example here that I have linked in the public libraries online resource is from the Athens Clark Atlanta Library, where they've implemented a trauma-informed library model. They've created a resource section that has life resources. So they're not billed as crisis resources or anything like that, just as life resources. And they also have social work interns there that provide a lot of services for the library. So that's one successful implementation of that model. However, implementing this kind of model does rely on a series of social work skills or principles that would inform that would be part of a trauma-informed approach. So these are all from SAMHSA as well, but the first one of them is safety. So physical and psychological safety for both staff and patrons. The second one is trustworthiness and transparency. So all decisions, actions, and processes build trust for all stakeholders. The third one is peer support from other trauma survivors and amongst staff, which is really important, especially when you're processing a difficult interaction with a patron, as a staff member at least. And then we saw examples of peer support with the peer support specialist with the DC Public Library. We also have collaboration and mutuality. So power differences are leveled as much as possible. There's a collaborative mindset amongst all within staff and across staff and patrons. Number 5 is empowerment, voice, and choice. People come first. Patrons are supported in cultivating self-advocacy skills. Staff support cultivation of self-advocacy skills, and they're facilitators rather than controllers. And that then staff are empowered by that. And then the final one is cultural, historical, and gender issues, where you proactively move past stereotypes and biases and offer access to gender responsive services, recognize historical trauma, and create culturally competent policies, protocols, and practices. So it's a lot of different principles that sort of inform this that support the trauma-informed approach, which can work in any kind of organizational setting, so any kind of library or archive setting. So that's a little bit about social work service models and practices and how they're partnering with public libraries. But I wanted to talk a little bit more about the work that Dr. Ogden and I are doing right now. as I mentioned, we conducted focus groups, and now we're working on some work. We're providing some workshops to library staff. One of them was focused specifically on homelessness, COVID-19, and self-care. And we asked, how do we better understand the acute impact of COVID-19 on people experiencing homelessness, and how do we support community members while also taking care of ourselves? So we spent a lot of time there talking about well-being and positive things that you can do for your emotions, for bringing meaning to your life, things like that. We also conducted some additional workshops on mental health, first aid, de-escalation, and boundary management. And our current research that we're writing up right now is focused on knowledge and skills that inform how library staff interact with people in crisis. We're working on a paper related to the workshops that we conducted to see like, okay, well, we did a pre-test and a post-test, and did these workshops actually help increase skills and confidence in interacting with patrons in crisis in supporting healthy boundaries? We have found that the workshops were helpful, which is good. And then finally, we're looking at issues related to boundaries and vulnerability that arise for library staff in doing the support work. And I think ultimately we'd like to pull this together and look more closely at service models as well. Another future project or project in its nascent stages that we're looking at is how to implement virtual reality training for library staff to support people in crisis. So essentially for this, we want to look at how virtual reality training might help build communication and de-escalation skills, as well as confidence in interacting with patrons in crisis. So the idea behind this is that a virtual environment is sort of a lower stakes opportunity for staff to be able to engage with difficult interactions and heavily emotional interactions in some cases, in a lower stakes environment that they can practice over and over again so that they can build both skills and confidence in these areas. So hopefully some perceived positive outcomes that we'll be able to achieve here would include reaching a wider audience. We're interested in implementing this training both for students and hopefully professionals in a continuing education context. And the immersiveness of this and the low stakes environment should hopefully be beneficial as well. That was a little bit about the current work that Dr. Ogden and I are doing, and along with Dr. Catherine Dumas and Joanna Flanagan, our student. But what can we all do right now? It's not research, but what can we just do to support these efforts? So I think, the professor in me is like, we can all learn more, but we can. So I always recommend that folks take a look at this book, which also has an associated website. It's called Whole Person Librarianship by Sarah Zetterval and Mary Nenow. It's a really great book that talks about how you can apply social work skills in library settings. It's not public library specific, and it has worksheets and case studies and different scenarios that you can implement in your own library practice, which is really fantastic. But the thing that I really love about this is the website that goes with the book, because it has a listserv that you can join. It's basically a Google group where folks talk about social work issues in libraries. So, maybe it's about, harm reduction in libraries or social work service models or things like that. Like, oh, how did you handle this kind of situation? Well, you can look at this listserv and maybe there's something about it, or you can ask a question and you have a community of folks that are invested in these kinds of issues that will talk to you about it, which is really great. The next thing that I always like to bring up is advocacy for supporting patrons in crisis in your library, which can be a little bit tricky, whether you're a patron yourself or somebody working in the library. The library's operating as an entity that's supported, usually through funding from from the town or county or whatever. So, there are organizational limitations and constraints for what libraries can do. But there are also small things that you can do to advocate for people in crisis, right? So you can take a look at your policies and evaluate them to see like, oh, is this punitive? Like, am I just going around and waking people up, or am I asking them how they're doing? Are we trying to figure out a better way to support people who do have a problem with sleeping in the library? And why do we view that as a problem? So really just kind of opening up conversations around small actions that you can take that will ultimately help create a more supportive and trauma-informed library space. And then also connecting with community partners. So there are lots of great community organizations and businesses and other departments in your city. And the reality of the situation is that everyone's super busy and probably under-resourced, and we don't have time. But if you just take the step to reach out to someone about an idea you have, oftentimes, a coffee conversation can turn into something bigger, which can be really beneficial for your community. So it's worth it to reach out, in my mind. So some key takeaways I just want to point out here are that public library support for people experiencing crises, such as homelessness, but maybe other stuff, is more important than ever, especially with everything happening in our world right now. However, supporting the well-being of library staff is also just as important. So we won't be able to support our patrons if we can't support ourselves. Additionally, supporting social work approaches and skills in libraries is sort of one way of establishing a set of additional tools that can support the well-being of library staff, which can be really valuable and empowering for them. Social work service models and collaborations also support the well-being of everyone in the library, particularly if we think about it in terms of a trauma-informed approach, such as the TILT model. We do have work to do. We can continue to educate ourselves, advocate for our patrons in our community, and connect with others. And then I just want to touch back on how this empowers library staff. And I think probably the most central way that staff are empowered by this is in thinking about and acknowledging the fact that library staff have been doing this work for a while. They've been doing this support work for a long time. And by acknowledging it, we're acknowledging that they need support and training and resources in order to be able to keep doing that work. So I think that's a really empowering thing, to just acknowledge the labor that goes into that, as well as the emotional labor, not just the 9-to-5 kind of labor. If we acknowledge it and put resources to it and support training and skills development in these areas, I think that can be a really empowering experience for our staff, or for library staff. And then I just want to return to the initial scenario that I mentioned with the teen in the library. Like I said, that was something that a library worker went through, and in that case, the staff member actually ended up bringing the teen home and giving them a place to sleep on their couch. We talked through that outcome, and the staff member was like, I don't think I should have done that. But I didn't really know what to do. And so the idea behind developing these kinds of skills is giving people the confidence to be able to connect with folks, and to be able to find the right kinds of resources and support as much as you can in these situations, and to feel good about what you did, right? And to feel empowered to do what you need to do to support someone, and to also just do your job. So thank you very much. I would love to talk more with you all and take any questions that you have and hear more about your experiences as well.